Hello everyone, we are from Group 3 HS2573B. We're presenting to you about folic acid. So here's our group members. Okay, first of all, let's see the introduction to folic acid. So, what is folic acid? Okay, let's have a look what is folic acid. Firstly, folic acid is a benign vitamin. However, folic acid is not the naturally occurring form of vitamin B9. It is because folic acid is a synthetic. It was a synthetic form of B9 vitamin. This means that folic acid was derived or manufactured. Therefore, folic acid was found in the supplements and fortified foods. Other than that, folic acid is a water-soluble vitamin. This means that body does not store them. In addition, folic acid is also known as terryl monoglutamic acid. So, who's need the folic acid? Okay, the people that need the folic acid is all women of reproductive age, especially for women who gets pregnant. It was so important for them to consume the folic acid. Next, let's have a look the difference between folate and folic acid. Firstly, folate and folic acid are different forms of vitamin B9. Folate is naturally occurring of vitamin B9, while folic acid is synthetic form of vitamin B9. Next, each of them have different structural and have slightly different of biological effects in the body. Lastly, folate is found in the number of plants and animal foods, while folic acid can be found in some fortified food and supplements.
Sources of folic acid. Folate, also known as vitamin B9, is found naturally in a wide variety of foods. And good sources of folic acid include legumes, leafy vegetables, fortified grains, supplements, beet, Brussels sprouts, citrus fruits, beef liver, and avocados. Multivitamins and prenatal vitamins, as well as supplements including other B-complex vitamins and supplements containing simply folic acid. Adult supplements typically contain 400 to 800 mcg folic acid, while children's multivitamin provide 200 to 400 mcg folic acid. Many grains, including bread and pasta, have been fortified with folic acid to increase their folic acid content. Although the levels vary depending on the product, 1 cup of cooked spaghetti contains around 102 mcg of folic acid, or 25% of daily value. Surprisingly, several studies have revealed that fortified food folic acid is more easily absorbed than folate found naturally in meals. However, it is particularly abundant in legumes. Legumes are the fruit or seed of any plant in the Fabaceae family, including beans, peas, and lentils. Amount of folate can vary, but they are an excellent source of folate. For example, 1 cup of cooked lentils contains 358 mcg of folate. Next up is RNI for folic acid. All of these categories are based on Malaysian RNI 2017. The RI Committee estimated folate requirement for infants using an adequate intake method. It is stated that infants from 0 to 11 months should receive 80 mcg per day DFA. Next, there was no information available to assist in estimating children's need. As a result, the years for these ages have been calculated using adult values. There is classification for age for children. For 1 to 3 years old, they need 160 mcg per day DFA. 4 to 6 years old children require 200 mcg per day DFE, and for 7 to 9 years old children is 300 mcg per day DFE. Adolescents need 400 mcg per day DFE. Both adults and elderly also required to take 400 mcg per day of DFE. Last but not least, folate requirements rise during pregnancy due to a large increase in single carbon transfer processes, such as those necessary for nucleotide synthesis and cell division. Therefore, an adequate intake folate for pregnant women is at 600 mcg DFE per day. To compensate for folate losses during exclusively breastfeeding, a lactating mother would need to increase her folate intake, which is 500 mcg per day of DFE.
Next, we move to the function of folic acid in pregnancy and anemia. Why do we need folate? Folate, utilized in folate cycle, acts as a precursor for formation of tetrahydrofolate THF. THF is required for purine and pyrimidine synthesis, amino acid synthesis, nucleoprotein synthesis, and catecholamine synthesis. Folate is involved in the supply of methyl groups to the methylation cycle. Methyl group is used by methionine synthetase. A disturbance in the cycle causes hyperhomocysteemia and low of methionine. Thus, cells are not able to methylate protein, lipids, and myelin. This will lead to developmental defects. During pregnancy, body needs folic acid to help make new cells, including brain cells, blood cells, and DNA inside the cells. During pregnancy, intake of folic acid can reduce risk of neural tube defects in baby's development. Folic acid helps baby brain and spinal cord develop normally. Even when the child is born, folic acid plays an important role in proper health management of the child. For mother, folic acid maintains the good nervous system and reduces disease. As we know, some people get anemia when the hemoglobin in blood goes down. Therefore, folic acid helps to get their hemoglobin level up. Next, folic acid helps make healthy red blood cells, which carry oxygen around the body. Folic acid assists the synthesis and repair of DNA, which carries genetic information.
Before we learn further about folic acid deficiency, we need to know that there are few causes that contribute to it, including inadequate dietary intake. Heating during cooking destroys folic acid and can limit the absorption, resulting in a deficiency. Elevated pH, as occurs in achloridria, in which absence of hydrochloric acid in the gastric secretions, can also lead to poor folic acid absorption. Alcoholism is a significant cause of folic acid deficiency, as intestinal malabsorption, decreased hepatic uptake, and increased body excretion of this multivitamin, mainly via urine. Drugs interfere with the metabolism of folic acid, such as methotrexate, trimethylamine, and metformin, can antagonize folic utilization, inhibit its absorption, or conversion to its active form, resulting in folic deficiency. The last causes lead to folic acid deficiency due to increased demand conditions such as pregnancy and lactation that requires more folic acid to be used by the body. Folic acid deficiency affects the body in a negative way, which leads to a disease called megaloblastic anemia. Megaloblastic anemia is a condition characterized by the presence of large red blood cell precursors called megaloblasts in the bone marrow, which result from impaired DNA synthesis. Biologically, megaloblastic anemia resulting from folic acid deficiency happens when tetrahydrofolate is reduced and thymidylate synthase, an enzyme, is inhibited. Hence, deoxyuridine monophosphate is not converted to deoxythymidine monophosphate. Thus, cell division is arrested due to DNA synthesis abnormalities. Essentially, this works when folic acid is important for DNA production. So, if you do not have DNA production, the process will end up stuck at the G2 phase of the cell cycle and continuously growing. Thus, the cells cannot go through mitosis stage. This can be proven by comparing the size of megaloblasts, which are huge with no DNA compared to the normal red blood cells. People with megaloblastic anemia may experience different symptoms, and symptoms may vary in severity. Some of the most common symptoms of megaloblastic anemia include abnormal paleness of the skin, fatigue, diarrhea, numbness or tingling in hands and feet, and weak muscles. Another most common disease that is caused as a result of folic acid deficiency is birth defects or neural tube defects. This disease happens in developing babies during the embryogenesis stage. Due to lack of folic acid in pregnant women's diet, the neural tube does not close. Hence, the baby may have a neural tube defect such as spina bifida and anencephaly. For spina bifida, the neural tube fails to close at the bottom. As a result, the part of the spine that encloses and protects the lower spinal cord do not completely form, allowing the cord to protrude. Children with this defect often require surgery and have permanent disabilities, including leg paralysis, developmental delays, and nervous system problems. In the condition called anencephaly, the neural tube fails to close at the top, preventing large parts of the brain and skull from developing completely. Babies with this defect are unable to live and usually die before birth or soon after. Folic acid deficiency may also lead to other birth defects such as cleft lip and palate, and atrial septal defect, which is when a hole between the right and left upper chambers of the heart fails to close during the development. Experts also recommend pregnant women take this multivitamin in addition to the food folic in their diet, because the body does not absorb folic found naturally in food as easily as the man-made folic acid.